is Ishani Bahara, and I am a senior at American Heritage School of Boca del Rey. My project is on the development of an edge intelligence low-cost point-of-care device to diagnose for chronic kidney disease, or CKD. CKD is the problem in which the kidneys are not able to filter out waste products out of your body as they are meant to. And a point-of-care device, in this case, would mean that a diagnostic test, in this case, could be done at a location that is easier for the patient to get to or be at, meaning that the test does not necessarily have to be done at a hospital or a doctor's office, but can be done virtually anywhere. After seeing what my grandmother went through with CKD while I was growing up, I wanted to be able to do something about this problem. I learned that around 90% of those with CKD are completely unaware of their condition due to a lack of affordable and accessible diagnostics. Because of this, I wanted to build a device that was low cost and non-invasive to help people figure out if they had chronic kidney disease, and therefore increase accessibility to affordable CKD diagnostics worldwide. The first part of my project involves using a cheap carbon electrode-based biosensor in order to calculate something called the urine ACR, or the urine albumin to creatinine ratio. The ACR is used to calculate the ratio of these two important proteins, albumin and creatinine, in the urine. Their increased presence in urine is indicative of deteriorating kidney function. This device only costs approximately $1, requires only a single droplet of urine, and can produce results within minutes. Now, the main diagnostic component in order to provide a CKD diagnosis is called serum creatinine, which is the level of the protein creatinine in the bloodstream. However, a major goal of this project was to create a completely non-invasive device. So instead of drawing any blood, I created a neural network that could predict the serum creatinine value. So I didn't have to draw any blood at all. This network uses both the urine ACR data, which would have been collected from the biosensor I mentioned in part 1, as well as other clinical and demographic data using the CDC's NHANES dataset. My neural network could accurately predict serum creatinine at an 87% accuracy. Next, in order to actually diagnose for CKD, this serum creatinine value is then plugged into a formula used to calculate something called the EGFR, or estimated glomerular filtration rate. The EGFR essentially is the estimated rate for the filtration of the kidneys to filter out the waste products from your body. The lower the EGFR, the more severe the CKD is. Since EGFR is thus an indicator for kidney function, it can be used to diagnose for CKD into its proper stage of severity. Overall, my prototype costs approximately $420, whereas current diagnostic tests that are out there cost upwards of $5,000. In addition, my device can be used to provide real-time, accurate CKD diagnostic results at virtually any location in the world within minutes. However, current tests are still required to be done in hospitals or specialized testing centers, and can take days, if not weeks, to return accurate results. For me, science fair changed my life. It was a great way for me to apply what I learned in a classroom into something that I could use to solve problems in society that mattered to me. I would learn to ask questions about the world around me and question how I could try to make things better in our society. But in addition to learning more about STEM, science fair taught me a lot about myself. Through the long hours that I spent in lab on my project, the competitions I was able to participate in, as well as the community of young scientists I've been so fortunate to meet, I've learned to persevere past setbacks, learn from my mistakes, and even improve my communication and presentation skills, all of which are becoming increasingly valuable to me, especially as I leave high school. And another thing is that I was able to meet a lot of other interesting young scientists, especially girls, who shared a strong passion for science just like me. And it motivated me to want to go back home and continue studying science, math, and technology, STEM studies, and pursue more projects, even though I was sometimes the only girl in the room. Thank you. Thank you so much for watching.